Hello. Individuals living with a learning disability, which may also be called an intellectual disability, may have worse physical and mental health than the rest of the population. An annual health check helps to promote health and well-being. Benefits of annual health checks include improving outcomes for our patients, opportunities for preventative care, signposting to support networks for physical, mental and social health needs, opportunities for review of long-term conditions, and opportunities for advanced care planning if relevant. Everyone over the age of 14 who is living with a learning disability is eligible for an annual health check. They should be invited by their GP practice. Previously, patients would often be invited to see their GP in person. However, since COVID-19, some aspects of our annual health check can be done remotely. Anyone with communication difficulties should be seen face-to-face if possible, as they would be less likely to communicate their needs in a remote consultation. If a face-to-face appointment is not possible, remote consultations can be considered. First, an appropriate need and risk assessment must be carried out by a clinician. The following can help you decide if a remote consultation is suitable: level of learning disability, presenting condition, comorbidities and medications, any recent contact with health services, and what support individuals require for daily living. Remote consultations can be considered for people in low or moderate risk groups. These appointments should be offered to individuals who might not initially require a physical examination. A pre-check questionnaire should be shared with the person prior to their appointment, so that a face-to-face appointment can be given if needed. A remote consultation should be followed up with a face-to-face review. This enables any further investigations and physical examinations to be undertaken. Individuals in a higher risk group should still be asked to attend a face-to-face appointment if possible. This is because they are more likely to have communication difficulties and complex medical needs. Meeting in person, with the carers and/or family included, will enable a more detailed discussion, provide an opportunity to identify the best way to communicate with the person, and develop a health action plan. Identify. Ensure your learning disability register is up to date on a regular basis. Check that all people with learning disabilities are correctly coded. The resource section of the RCGP website provides further information on how to undertake searches and populate the register. Plan and invite. Plan a flexible and individualised approach for each patient. Work out the best way to initially communicate with each individual. This may be via a letter, leaflet, phone call, or perhaps by speaking to a carer or support worker. Consider having a team member who can consistently lead on and review the progress. This can be the point of contact for the person with a learning disability, their family, carers, or support workers. Prepare and confirm. Ask the patient or their carer to complete a health questionnaire prior to their annual health check appointment. This helps to reduce patient anxiety by identifying their concerns and highlighting any possible reasonable adjustments. It also enables the patient and clinician to have a more structured approach to the consultation. All online communication with patients must be compliant with the organisation's data protection regulations. Here are some technical tips to ensure a smooth consultation. Use a device with high-quality audio-video capabilities. Send out the consultation link in good time and ensure this can be accessed by the patient. Ensure privacy settings for video consultations are in line with GDPR, and be prepared to swap to another form of communication if the initial platform fails. For a successful remote consultation, consider the following. Ask the person with a learning disability who they would like to be in the consultation with them. Offer a practice session before the appointment using the remote consultation platform. Regularly check with the patient that they understand the conversation. Try not to speak too fast, allowing the opportunity for questions to be asked. Always consider safeguarding. Who else is in the room? Is it a safe space for the person to communicate with the clinician? Consider using a checklist to ensure that everything has been covered. All measures should be taken to carry out an annual health check as a face-to-face appointment. If for any reason this is not possible, these tips should help facilitate an effective remote annual health check.